Good afternoon, everyone. We would like to welcome you for today's webinar hosted by Wairau Hospital. So basically, this webinar is split into three parts. We have the employer's presentation, that includes the video presentation, and then the second part would be the RMO presentation, and the last part would be the Q&A portion. And for the Q&A, everyone can ask questions live if they would like to do it. Just use the raise hand function. Or if they just want to put a text-based question, they can just put all their questions in the Q&A function of Zoom. So we encourage everyone, since this is a recorded webinar, we encourage everyone to please make sure that your questions are clear and concise. Now, if you have questions that are specific to your situation, we suggest that you send the question to RMO, you send us an email, and then from there we will be able to answer you. Now, I would like to turn the floor to our panelists, to our employer and RMO representatives for the self-introduction.
Cool. So my name's Eric. I'm one of the PGY2 doctors at Wairau Hospital. Been here from January last year. So started here as a PGY1 and having a great time so far. So yeah.
Good everybody, my name is Caroline Bain. I'm a PGY1 working at Wairau. So I started working January this year. So I have finished my first run, which was surgical, and I'm now currently about halfway through my medical run. So I'm about 4 months working at Wairau Hospital. Oh, you might be muted.
Muted, yeah.
Good morning, everyone. I'm Larissa Matheson, RMO team lead of Wairau and Nelson Hospital.
My name's Gina Hart, and I'm a house officer or first year junior doctor here at Wairau Hospital in Blenheim. Currently I'm on orthopedics, so it involves rounding with the doctors each morning and coming up with a list of jobs to do for those patients, and then often in the afternoons I head off to theatre to go assist in surgeries. Well, I specifically wanted to come to a hospital like Wairau Hospital because there's no registrars here. So it means that as a house officer you have a really close working relationship with the consultants. And it also means that you get a lot of experience at making decisions and managing patients that maybe you wouldn't get at a bigger hospital. So it's been a very steep learning curve, but I wouldn't have it any other way.
Probably about 2 years ago, I came to Nelson Marlborough and stayed here for a few summers while I was studying. Absolutely loved the place, loved the people, loved the sites. So I thought, why not work here as a PGY1? And
so one of the good things about the Nelson Marlborough District Health Board is that it's actually staffed really well. So when you want to get leave, as long as you put in sort of adequate time in advance, you usually get it. And it's a pretty rare occasion where you don't get your leave.
I'd say if you're ready to be sort of thrown into it and have to learn things really quickly, but still within a very supportive environment, if you're willing to have a really close working relationship with consultants and not have a registrar, and at the end of that feel like you've learned maybe what you might have learned in a year at a bigger centre, but learn that within months at a place like this, then I'd highly recommend coming. And also if you want to come to a place where when you leave the hospital there's just so much to do in the outdoors, and if you like good wine and good food, and also just be in a very relaxed and chilled out town where any stress that you might get from working in the medical world is often waylaid just by the environment that you're in. It's absolutely beautiful up here.
So kia ora, I'm Caroline, so I'll start us off. This is Wairau Hospital. So beautiful sun, obviously a beautiful sunrise morning or something. It's quite a small hospital. And actually if you're here currently on the Zoom, you probably can probably know this already. Actually, that's what sets Wairau apart from the other hospitals, and that it's small, which is probably what made you curious enough, or potentially was one of the reasons that made you curious enough to come to this webinar. So this is just, again, introductions, but you know who we are already. Oh, sorry, there we go. Okay. So about Wairau Hospital. Wairau Hospital is a 65-bed hospital, so that is split up into inpatient units, so surgical, medical, and then we have pediatric, obstetrics and gynecology units as well, and then we have a 4-bed high dependency unit. And we actually serve a very large region, so that's 50,000 people. So I've just put a map there. You can see we own most of Queen Charlotte Sound. We look after this area, and it's very much like a trigone of many points in New Zealand. So it's very easily accessed and close to Kaikoura, Picton, very close to Wellington, actually, just a hop, skip and a jump. So 2 hours drive from Nelson and 4 hours drive from Christchurch.
Cool. So, I mean, with regards to, applying for a job here, obviously writing your cover letters, but also beneficial to try and get an interview. A couple of the medical physicians are keen to chat to you. They help make the decisions on who they're selecting. So if you're not going to be able to get up to the region for a face-to-face interview, they're also happy to do them online. So if you flick Loretta an email, she'll give you the details at the end. Get in contact with her and you'll be able to arrange a Zoom meeting, or if you're going to be here, even better, come along and say hi. And then, yeah, just like every other place, looking at the ACE scoring and looking at your CV and your references as well. Things that do help is if you do have an interest or a connection to the area. So, even if you don't know people here, the fact that, you like, doing the outdoors things that are around this area, or you kind of have a community connection in some kind of cultural or sporting area in the community, then really keen to have you on board, and be keen to work as part of a small team. So, everyone, all of the junior doctors all know each other, all of the consultants right across the board, all specialties all know each other as well. So kind of by the end of even kind of 3 to 6 months here, you really know the vast majority of people in the hospital. So, yeah.
So, like I said before, Wairau has one of the smallest intakes of students into PIs or PGY1s into the hospital. There are 5 positions available, and I don't think that's changed. Loretta can confirm, but I don't think that's changed this intake. And the runs are very much, I won't go into too much detail about the runs, but they're very similar probably to other runs that you can get in hospitals from a broad perspective. We don't offer small specialist trainee runs. So the hospital, we have a general surgery run, but that's also meshed together with ENT. So there's no large ENT run, to be clear. We don't offer services like pediatric surgery, so you can't do a run in that. So just generally, general medicine and general surgery are 2 that you'll definitely do in the first year. And then we have orthopedics, we have assessment, treatment and rehabilitation run, and we have relief. And then I'll just go on to talk about second year runs as well. So all of the ones from the first year are available, plus you do a community run, so hospice, urgent care, or a community GP. And then a huge attraction to Wairau Hospital, I suppose, is our amazing emergency department. So in PGY2, you get to do 6 months in ED if you should want to. And Eric can touch on that because he is currently doing that run. And in addition, obstetrics and gynecology and pediatrics, which is a combined run, and then relief, which we've talked about before.
Yeah, with regards to the ED run, you can do a full 6-month stint in ED. The benefit of that is you can apply to do your emergency certificate, so you can get a small qualification in emergency medicine coming out of PGY2, which, you know, is quite difficult to get anywhere else. So if you're thinking about emergency medicine, or even, you know, to be honest, anything across the board, whatever specialty you're looking at going to, certificate in emergency medicine is, you know, a pretty good thing to have on your CV, and just kind of get you more engaged and train up even more and get some extra skills. So yeah, really cool ED run that we have here.
So this just gives a couple of points towards what the orientation week looks like. From my experience or my understanding and talking to other people from different hospitals, it's very similar to what other hospitals and PGY1s up and down the country go through. So we had basically a week's orientation, and we go over and we do the first half of that with Nelson, which means that we can get a better grip on the services that are offered in the Nelson Marlborough DHB, because it is a combined DHB. And then we have an excellent, I think, orientation week here, where we get to talk to the consultants before we start the runs. We get any tips. Right off the bat, they're talking about really good practice on the wards and how the system works here, because as I said, it is quite different. And they basically introduce themselves straight away, and there's an opportunity to be social with them beforehand. And on the Friday, we are shadowing on the wards, which again was a very useful experience before we went into it. And additionally, we're lucky here in Wairau that we work very closely with the MDT team. So this is the first opportunity to meet pharmacy, radiology, physios, social workers, people that you're going to be seeing on a day-to-day basis on the ward here at Wairau, which is also another amazing thing about Wairau. So we've already done that, so I'll just skip that. So I'll let Eric speak to this one, but I just thought I want to give you guys a rundown of what the roster's like here, but it is very similar, I'd say, to other hospitals around the country.
Yeah, so I mean, the day you're kind of rostered for is 8 o'clock till 4 o'clock. You know, often you can get your prep done, you know, within 15 minutes to half an hour before the start of the day. It kind of depends how much you like to have prepped. Some people can show up right before 8 o'clock. Others like to kind of have more bits done and show up a bit earlier. But for the most part, I think what's different here to a lot of other places is when 4 o'clock comes, for the most part, you're finishing at 4 o'clock. Because it's a smaller hospital, there's a lot of times when you just don't have that much patient load. You round on patients fairly quickly, you can get your jobs done fairly early. And then, you know, by 4 o'clock, you're all done and dusted for the day. At the start of the year, when you're kind of slower and figuring bits out, often you can kind of stack on a little bit later to get bits done, but definitely later on in the year, 8 till 4 is pretty reasonable. The long day here, we've got one of those per week, and that means you work your day 8 till 4, and then from 4 o'clock you work up until 10 o'clock that evening. So it's a pretty long day. On the long day, it's you managing all the wards across the hospital. So it's a pretty cool opportunity to, even if you're on a medicine run, you're being consulted for surgical patients and things as well. At the start, they roster you on with a buddy for your first long day or two to make sure that you know everything is and how things run. And then that's kind of your first real opportunity to feel like you're in a smaller place, because you're the one doctor looking after kind of all of the wards, but obviously the consultants are always on call. So give them a buzz if you've got any questions, and they're more than happy to help. Weekends, so yeah, about 1 in 4 weekends. When you work a weekend, you work the 10 days in a row, and then you get generally the Thursday, Friday off at the end of your 10-day stretch. And in those 10 days, you won't have a long day. So you're either going to have a long day in your week, or you're going to be working the weekend. And then, 5 nights, 5 nights a quarter-ish. You kind of can be asked to volunteer to go on a backup roster. So the person on their long day, sometimes they get pretty swamped, it gets pretty busy. They've got a backup that they can call in and bring them in for a few hours to help them do a bit of extra work. So if you're being on call that night, you get about $50, I think, for kind of waiting for a call, even if you don't get a call. And if you do, then you get called in, and whatever you do, you get paid for 4 hours or more if you work more. So yeah. Oh yeah, and then with regards to teaching, so there's kind of different teaching that we get throughout the week. So we've got a couple of really good new general surgical consultants come across from the UK, and they're real keen on teaching. So they're doing sessions every Tuesday. Every Wednesday, we get 2 45-minute sessions. Those are on Zoom, shared with Nelson. So often Nelson have the people face to face, and we're on Zoom with them. So we kind of grab our lunch and have, an hour and a half or so up in the seminar room, doing some teaching. And then, yeah, the core. So you get to do some core training at the start in your orientation week as well. And then there's extra teaching optional on the Thursdays as well. So yeah, and then all of the consultants are more than happy to kind of teach you as you go. Some, need prompting, and you ask them a few questions and they're happy to kind of share what they think and teach you. And others, particularly that surgical department, will just try and teach all the time. So yeah, really good if you're keen.
Yeah, so I think Wairau has some, there are a lot of things that set Wairau apart from the rest of the hospitals. And one of the big ones here, which it might change, it might not, but it is that there are no registrars. We do currently have one registrar, one surgical registrar, and we occasionally get some more. But on the whole, the system is designed not to have registrars. So you have a very close working relationship with the consultant. And what does that look like? That probably freaks you out, especially if you're working in larger centres where you rely a lot on your registrar and you see the registrar all the time. Really, your consultants adopt a more hands-on role, and then you also step up and fill that registrar position when required. So really both of you are meeting in the middle when it comes to care with the patients. And I think actually I'm so glad that I picked this hospital because of this reason. It's worked out really well because you just have an amazing working relationship with the bosses and the people that make decisions, and you really can be led to as much independence as you like, and as much as your boss is comfortable with you adopting. So really you have no choice but to keep growing throughout your entire journey, I suppose, working in the hospital. The team here is small and friendly, and I think this is key because when you start working in a new system, we were all really nervous, but here I felt so supported by people because we all know what it's like, and we all see each other very, very often on a daily basis. We bump into each other on the wards, and so I felt very supported starting at Wairau because people were always available to help out. From a practical skills point of view, Wairau offers again a very unique scenario where if you want to get hands-on skills or obtain hands-on skills here in Wairau, you can very easily. There are PGY1s that basically managing operative cases by themselves. They're operating on patients with the SMOs watching. There are people learning to do ward-based procedures, lumbar punctures, I know spinals and intubation if anesthetics is your thing. And of course, ED is an amazing opportunity to advance your ultrasound skills, which are always very highly regarded here, and the learning is really amazing. And not to mention free coffee for which always comes up, but it is amazing. We're lucky in that we get a free coffee every day here at Wairau Hospital. And I mean, we've just talked about work, but the area and the lifestyle you can live is a huge attraction to this area, and we all share that same love for this region. Everyone in the hospital does, so that's why I suppose we're so close-knit. Oh, and I thought I would dot down a couple of things that are really useful to know. Not something that you should hang your hat on, but systems, from a systems perspective, things that it might be helpful, that change based on the hospital and how rural a hospital is. So we use paper notes, and we have paper blood forms and paper drug charts, and we don't have Cortex at Wairau Hospital, but we do use the Health Connect South system, which is a South Island system. So we have access to South Island notes. Radiology requests and OBS charts are all online, and making referrals to other services are all online. We get all of our imaging reported. Some hospitals don't. We get all of our imaging reported, and we get very good feedback time for that. We don't have an ICU, which we are similar in some ways to the smaller hospitals, but we have a high dependency unit. And during your medical run, you are expected to work a run on that high dependency unit. And a lot of us, because of the practical nature of our job, we actually wear scrubs every day. So it's optional, but if you wanted to, you could wear scrubs every day for the entire, for however many years you're here. I'll hand over to you, Eric, if you had anything to add. Your pros.
Yeah. No, I think, important to kind of factor in the the benefits of working here for your your future career, and you'll probably learn more here in a couple of years than what you will anywhere else. So education wise, work wise, it's great, but I think it's super important as well for that kind of outside the hospital work-life balance, as people say. I mean, those are all photos from just last year, all the trips that we've gone on, social touch team that we have. We've got a social indoor netball team that the house officers play in. I know a couple of the guys love diving, as to the consultant, so they've gone out and scuba dived and free dived together. So if you're keen on some work-life balance, it's definitely a place to come as well. You finish at 4 o'clock and there's time to go and do bits in the evenings. And then just with where the region is, there's kind of limitless things to do out and about. So yeah, definitely plenty on. There we go. So yeah, the PGY1s each year organize the hospital ball. So it's kind of a fundraiser event. So everyone in the hospital gets along to that. Quiz night, we're also doing weekly quiz nights at this rate. House officers have been entering in the quiz teams. Unlimited wineries, vineyards, you can go out, like I said, touch, netball, social water polo. So yeah, heaps on. Definitely a great place to be. Slightly smaller town in terms of nightlife, or places for brunch and things like that. But if you're keen on getting out and about and doing things, and there's not really a better place in the country. So yeah.
Yeah, I have to admit, it seemed alarming to apply for a hospital of this size, but I'm so glad I did, and I can only sing the highest praise of working at Wairau Hospital. So I'll finish on that and hand over back to the ACE team, whether I suppose we go to Q&A.
Thank you for that, Carol. Yeah, so far I don't have any questions in here. I couldn't see any text-based questions put in here. But yeah, I'd like to ask for on behalf of the applicants, this is the common questions that I used to get in my emails. That first, I just want to know from the employer's perspective, what usually are the major considerations in making the assessment and ranking?
What was that? Can you say that again?
What are your major considerations in terms of making your assessments and ranking of applicants?
Oh, okay. So I think if people are really serious about coming to Wairau, they'll come for an interview or have a look around, or at least apply for a Zoom meeting with Rion. It would be good. It would be nice to have a photo on the CV, would be lovely, and just on the covering letter, a reason why they would like to come and work at Wairau Hospital.
Do you have a major consideration when it comes to getting 2 references from one placement? Do you have a more preference to getting 3 references from 3 placement over 2 references from just 1 placement?
2 references is fine. Yeah. And I don't believe Wairau goes on the waiting system that ACE has. Yeah.
We have a question here. It's asking, on your long day, are you the only house officer in the hospital and covering all the wards? I think this is for the RMOs to answer.
Yeah, so yeah, after 4 o'clock, yeah, you're the only house officer who theoretically covers medicine, gen surge, ortho, peds, and O&G. There is a house officer and ED consultants in the emergency department right up till kind of midnight. So, you know, if things really went haywire, there is consultants in ED, but the consultants are also on the phone the whole night, the medical consultant, the gen surge consultant. So yeah, you're kind of the first port of call for any of those specialties in the hospital. And then you kind of make your decisions and decide if you can manage it yourself. And if you're struggling or you're unsure, then you just call the boss. And Kara was talking about it before about how, you know, because there's no registrars, the way the consultants describe it is they kind of step down into a senior registrar level and the house officers kind of step up into that junior registrar level. So that means that, you know, it's actually acceptable to call the consultant for stuff here that you would just never call a boss for in a bigger center, because you'd call your reg, and they know that. That's why they're working here. They like the lifestyle, and they accept as consultants that because they work here, they're going to get calls that they would just never get anywhere else. So if you have a super small question on a long day and you're not sure, you can just call the boss and they give you an answer. So you step up and you manage patients by yourself as much as you can and as much as you're confident to, and then they are always there for you if you need a hand. So yeah.
Second question is, how stressful has it been covering or doing PAIDs or I think obstetrics gynecology stuff after 4 p.m. as a PGY1?
Sorry.
You go, Caro.
We both obviously have something to say about this.
Go ahead.
No, you ask an excellent question, because I remember when I was a TI, I actually asked Eric this exact same question. This was a really daunting concept, and I think I owe that to maybe the lack of training and how overwhelming and how different the medicine is in those 2 areas. So, great question. So what is different between Wairau and bigger hospitals, in that the pediatric service here is excellent and very supportive, and so the consultants acknowledge that they're going to be called all the time when they're on call, or even work later those nights. So the pediatric doctors here are amazing, and I have a much lower threshold to call them about people. And actually, in fact, they prefer to know about patients that are coming in, maybe patients that you're admitting to the ward, which they will already know about. And they will be very clear in their management plans and what they need from you, and they won't push you too far or ever make you do something that you're not comfortable doing. And obstetrics and gynecology, we probably have less exposure to on the whole, because that service is really run by consultants when emergency C-sections are required overnight. The SMO, the bosses, come in to do those, and also really it's just midwives that work in that system, but you can be asked to go over there to assist as needed, or to assist in C-sections, that kind of thing. But good question. It is daunting, but actually it's a really fun part of our job, in that we get to practice a different kind of medicine to the run that we're on. So it's quite nice to go and spend your time learning about children, or learning about obstetrics and gynecology in a real sense. Yeah.
Yeah, and I think we're, you know, as junior doctors, we're not the only ones that kind of step up and do more early on in their career. So the same applies to all of the nursing staff too. So the nursing staff that are here, they've been in a small hospital with more responsibility themselves. You know, we step up into a junior reg role, they step up into a house officer role, you know. So when you rock up, the nurses know a whole heap more than you, and you know, rock up to the ward and they almost know what they want you to do. And you ask them, you know, you ask the nurses for advice and you ask them for help. And if they're unsure and you're unsure, then the bosses genuinely, like Caro said, they want to know. They'll be pretty frustrated in the morning if you've tried to manage a kid by yourself, even quite simple stuff, and you just haven't even talked to them. Like, the best way to go about it is to, you know, assess a kid, make your plan, and then you call them and say, this is what I think, this is what I want to do, but I just want to run that by you. And that's a really good call for a consultant to get, because, you know, it shows that you've been thinking, you've come up with a management plan, but you want confirmation about that being the right thing to do. And they're more than happy to take those kind of calls, rather than, you know, just saying, oh, I've got a sick patient, help. You know, you can do some thinking and then give them a call. So it sounds real stressful, and, you know, it is daunting at times, but yeah, there's definitely support there.
So far, that's it for the questions. Is it easy to find a house there if should they decide to move into your district?
There's a hospital house. So the DHB, or Te Whatu Ora, owns 3 or 4 properties right beside the hospital. So if you move up here, provided there's not a whole heap of UK doctors across here in the places, you can stay in there for kind of 3-ish, 6 months while you find a place. So they won't let you go empty. And then, yeah, there's limited like single bedrooms up for grabs, but if you know a few people, or you spend that first 6 months and then go out flatting with a group from the hospital, there's actually plenty of places, kind of, yeah, reasonable price as well. So yeah.
Is there anything else that you would like to give as an advice or tip for our applicants, especially that they're now busy doing their ACE RMO application based on your previous experience?
Oh gosh, I mean, it does. It wasn't so long ago that I was in your situation. Definitely, it's not an easy thing. It's kind of a daunting task, writing a CV and a cover letter. The references, I'm sure you get lots of advice about references and who to get, and from different runs if possible. They are important. I think they matter quite a lot, and it's good that, you know, I would put quite a lot of effort into forming good relationships with consultants and trying to get those good references. And really, no, cover letters are just about showing that you have done your research about the areas that you want to live in, and really like nailing down in the you know, in the finer print. Why you want to come and work to an area will really demonstrate how much effort you've put into looking into the region. But your passion, if you're really keen to go and you show your interest, your passion will come across in that kind of stuff anyway.
Yeah, I agree. Kind of, don't just focus your cover letter on why you'd be a good fit for the hospital, but why for the whole region and for the community and stuff as well. You know, like, you come to work here and you're part of the hospital, but you're also part of a, you know, a bigger town, and kind of write about why you want to be here in general, kind of beyond the hospital as well. But yeah, I think it's a great place to work. I think there's heaps of opportunities. You can kind of, it's limitless how much responsibility you want to take on. So yeah, definitely worth thinking about coming here. Plenty of cool people, and yeah, fun things to do too.
Okay. For Loretta, I'd like to ask, I don't know if I missed this information. Do you hold interviews on site or not?
Yes, we have one of the physicians actually carries out, he's a pre-vocational educational supervisor as well, carries out interviews at if anyone is able to get there. Anyone can email me and I can organise the appointment with the physician. Or this year we're actually also doing Zoom interviews if anyone's interested in Zoom.
Okay.
Another point with that as well, if you want to kind of know more and you're able to get up to the region and just want to walk around the hospital, most of the house officers would be more than happy to step away from work for a while to give you a tour. So yeah, definitely come up, and there'll be someone there that's free that can walk you around the hospital and answer kind of more specific or personal questions or worries that you've got. So definitely worth coming up if you're able to, or down, depending on where you are, I guess.
Yeah, and if you're seriously considering Wairau or a hospital nearby, I do urge you to get in touch with us. I'm more than happy for you to message or email, because it can be daunting. Wairau is on a far end of the spectrum, and it is always nice to know a familiar face before you start or before you apply and decide that you want to work here. And there's lots of advice that we can give you, and so just please don't be a stranger.
Okay. I think you were able to cover everything, because there are no more questions. And in case, 'cause I mentioned earlier that in case that they have a specific question specific to their situation, they'll definitely email. Either they can email the employers directly to discuss that opportunity, or email the ACE RMO. So I think that's it for now, and I would like to thank Loretta and Eric, Caroline, for making this presentation really feasible.